When is liposuction needed? I'm not sure if it's a properly worded question. Not sure if it's ever needed. It's when is it wanted? I think is a better question, and it's really personal type of thing. Obviously, we know there's plenty of people who want to liposuction certain areas where other people pay a lot of money to put fat back into those areas. So, you know, it's personal. How much fat typically is removed? Again, depends how much fat you have, but we maximize it at 5 liters. So in the office setting, in a surgery, outpatient surgery setting, I can only take out 5 liters safely, and that's my max. Possible complications. As I said, every surgery has that possibility. We do our best not to create any complications, meaning, you know, if we are putting you to sleep, we have anesthesiologists doing that. If we're doing it in an accredited surgery center, everything is sterilized in sterile conditions. We'll follow you closely afterwards with all the precautions that we can do from surgical standpoint, because we treat it as proper surgery and not just something you can do, you know, just to do. So as long as we follow our surgical technique and precautions, we prevent a lot of complications. But potential complications, you know, leftover fat, maybe non-even distribution of the fat afterwards, scarring from the little liposuction holes. Those are the most common things I could think of. Of course, there are stories, I guess, and reports of people getting infection, people getting fluid collections, and of course, more complex complications, but those are quite rare. What is the age? I usually would not do liposuction anybody under 18, and even at 18-year-old, I probably would really counsel you on why we're doing it and if it's too early to do it. So I really do sit and spend time with the patient based on their age to decide if they are ready for this. Is the liposuction better before or after pregnancy? Personal choice, you know, it depends how much weight you're planning to gain. Again, it's not the weight loss procedure, it's shaping procedure. So once we shape it, those areas generally don't gain as much weight. The distribution of the fat will change after liposuction a little bit. So I obviously recommend to maintain your healthy lifestyle and maintain your weight after the surgery. If you gain weight dramatically, it might not go exactly to the same spot, but fat may go to another area. And if you gain enough weight, this area also will regain weight because we're not taking out every fat cell, right? There are some fat cells left over, so they will just get bigger. So with pregnancy, I would say to consider that. What if I gain weight after liposuction? I just said that. Does liposuction hurt? Not if you're asleep. So I prefer to put you to sleep if I can, if we're doing a lot of areas. It can be done awake, meaning with just a little bit sedative or Promax, like a little laughing gas, and we of course put numbing medicine in. Small areas, I don't mind doing it like that. Larger, bigger areas, I'll say just go to sleep if your health allows. If for some reason there's health problems where you might not be or don't want to go to sleep with general anesthesia or sedation, then of course a local can be done as well. And that way it should really hurt, but might be a little uncomfortable if you're awake. What about touch-ups? Touch-ups can be done on awake patient. You know, if it's a small area where after it's all healed up, there's like a little lump or a little something that bothers you, it can definitely be done, and usually in the office setting. Will I have loose skin? Yes, it's a potential problem, and that's where your surgeon has to advise you beforehand. So certain areas, especially lower abdomen after you had kids, thighs, if you liposuction a lot, that skin, especially an older patient, if you don't have a good elasticity to your skin, can become saggy, and that's where you have to talk to your doctor about skin tightening procedures or excisional procedures to decide what's better for you, such as combination with body tight or maybe tummy tuck, and so on. Are there any post-liposuction scars? Generally very small, and we hide them very well. So that's kind of one of the main things that we do during liposuction. We try to hide them in your bikini line, inside the belly button, things like that. So generally we try to avoid any visible scars. How long do I need to wear a garment? I usually say we're gonna do definitely like 24/7 for about 2 weeks, and then we see how you're recovering, how the swelling is going, and we're gonna take it, to like 12 on, 12 off, and so on. Can I go home the same day? Absolutely, please go home the same day. I prefer for you to go home the same day, but you come back the next day for me to check on you. When can I fly? A couple of weeks I think is reasonable, as long as you're ambulating well, which I do require for all my patients to start walking after basically day one after surgery. You have to get up and walk every hour to prevent blood clots, and that's the risk of flying, is really blood clots and blood clots traveling to your lungs. So if that needs to happen, I would definitely talk to your doctor, make sure it's safe, make sure they're safe when you're doing it, and give you all the precautions and potential prevention for flying, from getting complications from that. How much does it cost? So in most areas you will get charged by area. So for example, upper belly, lower belly is like 2 areas, flanks is the 3rd area, and so on. And that's kind of standard for a lot of people that I've seen. And of course, a lot of times you would get like discounts for packages. You don't do so many areas. Most places will give you some kind of a discount for that. Side effects. We already covered that. So side effects of liposuction, again, it's not a weight loss, it's temporary solution, it's more of a shaping. People who use it as a weight loss solution, probably not going about it the right way. I would always recommend a weight loss surgery procedure first, which of course is great because here we do have that available, right? Because we offer all the weight loss procedures and opportunities. So I will work with my patient, either medical weight loss, balloons, endosleeve, sleeve, to get them to where they want to be before I would offer liposuction, because otherwise I feel like I'm just wasting their money. What else? Non-invasive treatments of lipo. There are a lot of devices out there like cool sculpting and sculpture and body effects. That's a radiofrequency type of procedures. They're good for non-invasive, but usually the surgical liposuction gets you really better result as far as really getting that fat out, really getting much better shape because surgeons control you during the procedure. Additional treatments like body type. I believe we talked about it in the previous video about sculpting, where I can use body type, which is radiofrequency assisted liposuction, in combination with powered assisted liposuction. We can get very good result and skin tightening at the same time. And we can actually talk about all of that combination on my open house event September 19th. We'll be meeting here in this Loganville office. We'll have hors d'oeuvres and champagne, the usual meet the doctor stuff. You can have a little mini consultation with me. We can sneak in a little room while crowd is out there. I'll pick at you, I'll tell you what I think, set up for main consultation if we have to, and of course get all kind of specials, which will be announced in a couple of weeks. And for that you have to follow me on Instagram and my Facebook to see what the specials will be. But they'll be very interesting.